typically the most common causes of sciatica come from one of three things. Typically it comes from some pressure of your piriformis muscle on that sciatic nerve. This is my piriformis muscle that sits deep in my buttocks. That sciatic nerve actually travels through that piriformis muscle right before it enters that hole that it uses to get through the pelvis. So if that piriformis muscle is nice and relaxed and loose the way that it should be, then there's no pressure on that nerve and there's no crimp in the hose, there's no pressure on it, and the signal will be fine and I won't have any symptoms. But if something's irritating that piriformis muscle and it starts to get tight, that piriformis muscle will crimp down or tighten down on that nerve and it will start to give me those symptoms down into the leg. Sometimes initially the pressure on the nerve is not there all the time, so the symptoms will come and go. But typically as a sciatic problem or a sciatic nerve problem progresses, the symptoms become more constant. Things like sitting would actually make it worse, because when I sit and my hip bends to 90 degrees, there's more tension on that piriformis muscle, it gets tighter, therefore it puts more pressure on that sciatic nerve, it gives me more symptoms. Typically standing or walking for any period of time where the piriformis muscle is contracting and relaxing, it's continuing to compress and release on that nerve and it will give me more symptoms. The two other common causes of sciatica and sciatic nerve problems, it really stems out of your back and then out of your hip. If your back or your SI joint, your sacroiliac joint, aren't moving properly, aren't positioned properly, it's going to put tension not only on your piriformis muscle but on other muscles in your hip and in your buttocks, your gluteal muscles, some smaller muscles called your obturators, etc. And if any one of those muscles starts to get tight, they can start to close down that opening for the nerve. They can start to put pressure on it. They make the piriformis tighter. If your SI joint or your sacrum, your pelvis isn't moving properly when you move, like when you sit and when you walk, then it's going to put more tension and pressure on that nerve and give you those symptoms as well. We will sometimes very commonly see that somebody that has a hip problem actually ends up with some sciatica problems as well. Because again, when your hip joint is arthritic or painful, or you have an IT band problem or a hip strain of some kind, your hip stops moving normally. And so what that means is that your pelvis has to start moving more, which puts more tension on that sciatic nerve, more pressure on it, more symptoms, etc. So there's really two main treatment options. The first is more of a temporary treatment option. That would be medications or injections. So think about it this way. If something's pressing on that nerve and giving you those symptoms, if you took some medication, let's say a muscle relaxant, well, it's going to release some of the tension in that piriformis muscle, but it's not going to change what's actually going to cause it to go back and being tight. So in the 8-hour window that you've got that muscle relaxant in your body, yes, you might have less symptoms, but it's a false fix to the problem. You could do a cortisone injection or a steroid injection directly into that sciatic nerve, get instant relief in most cases, but it's not going to be long-lived, because all I did was change what the nerve was feeling. I didn't change what was causing the problem. And so while those are very valuable treatment options in terms of helping to reduce the symptoms, they aren't very good long-term treatment options. Well, that's really where physical therapy comes in. Physical therapists are the only movement specialists that are able to fully evaluate and assess what's going on with your SI, with your sacroiliac, with your sciatic nerve, with your piriformis, and figure out exactly what it is that's causing that pain and those symptoms down the back of your leg. And once we've done a full evaluation and we've determined exactly what's causing the problem in you, then we can put together a treatment plan that's going to address that. Yes, sometimes it does mean taking some medications at the same time to minimize your symptoms so we can do things. But long term, what we're going to do is fix the rotation of that pelvis so that it's back to its neutral position, so that the pressure is off of the sciatic nerve and the symptoms are gone. We're going to get that piriformis muscle to permanently release. Unlike a muscle relaxant that temporarily gets it to release, manual physical therapy is going to get that pressure off of that nerve and keep the pressure off of that nerve. Keep in mind that not all physical therapists are manual specialists. You need, in order to treat sciatica, you need to see a physical therapist that is a manual specialist, somebody that can work on rotating that pelvis, work on getting that hip to move the way that it's supposed to so that your pelvis doesn't have to move, work on getting your spine to do what it's supposed to do, get that piriformis muscle to fully release and stay released and not tighten back down and put that pressure back on. All of the physical therapists here at Loudoun Sports Therapy Center are manual therapists. They all are expertly trained in how to do those things. So if you're having any symptoms of sciatica, any symptoms into the back of your leg or any part of your leg for that matter, get it treated. It's not going to go away on its own. It's only going to get worse. Get it treated by treating the symptoms now and fixing the problem in the future, and get it taken care of.